Good morning and welcome to today's myofascial moment. Today I'm going to work a bit with rotational releases. Now in my body and a lot of people I work with, we tend to get rigid between the pelvis and the spine. We're used to moving and living and working in a forward and backward sort of plane, and we lose a bit of our rotational ability. Specifically, and again, many people I work with, lose the ability for the spine to rotate relative to the pelvis. Most of us can turn our whole body. We can do that. We can turn our whole body. But to move the spine and the shoulders relative to the pelvis, a lot of us get rigid and stuck and tight in the low back. This can be a source of low back pain. This can be a source of shoulder trouble, neck trouble. Anything higher up the chain from the pelvis specifically can start to get a bit of trouble. So again, I like to work with rotational releases. Now, I do have a fairly firm chair here. I am going to turn it sideways so you can kind of see what I'm doing. When I do these rotational releases, I want to have a good sense of support. So for me, I've got my feet on the floor. My chairs need to be a bit lower. With a rotational release, I want to make sure that my hips and my knees are facing one direction while I start to rotate from the spine. Again, my hips and my pelvis aren't coming with me. Start to rotate my spine around to the side. Now, I'm a bit limited in my rotation and today, so I need to shift the chair. So again, settle my pelvis, my feet on the floor, and then just start to rotate, thinking of my spine like an entirety. It's not just my shoulders. I don't want my chest still facing that way. I actually want all of my upper body to come into a rotation. In particular, I like a chair with a back because I will use that to support just a little bit. Now, for myself, as I work with this sort of rotational release, I tend to have a lot of stuckness in my rib cage. So I know I've got a rib back here that tends to sort of cramp. I want to kind of ease around that cramping. I don't really need to push into it, as that one is difficult for me to breathe through and soften through. So rotational releases follow the same principles of other myofascial self-treatment. Good myofascial self-treatment happens over a 3 to 5 minute period of time as you soften and settle into your body and allow tissues to change without forcing, without really trying hard. Just let gravity or rotation or my arms supporting me here work into that release. Now with this, I know I have to be very conscious to let this left hip drop. I tend to want to bring it with me as I feel this tightness in my ribs. As best you can, at least in these beginning stages, you don't really want to tip. You don't really want to collapse into anything. You want to keep your spine nice and tall. Again, rotating from the base of the spine all the way around with your shoulders, your neck, your head. Now, as I stay here, again, soften in my left hip, I will start to gain a bit of range of motion. Now, the point is not to twist all the way around and look behind you. The point is to work with any restrictions you might have in the ribs, in the shoulders, in the low back, anywhere along the spinal column relative to the pelvis that's preventing you from rotating. Now, if you can imagine, this is really good for anyone having difficulty as they drive and try and look over their shoulder. If you feel a stiffness there, or a total avoidance there, or a, whoa, I can't completely look the other direction to check for cars, to check for things behind you, you need this. We all need this. So I do my best to keep my eyes level. I do my best to keep my spine upright. Now there are other self-treatment practices where we'll use some crunching and side bending with rotation. That's not today. That being said, if you do find some organic, natural, drifting motion that's either pulling or pushing or just kind of drawing you in to a different shape, follow that. Be curious about what's happening in your own body. Good myofascial self-treatment is never protocol-based. It might not look at all like my self-treatment. Just looking to give you some options and give you a bit of instruction, a bit of an idea of how you might engage with your own body in a way that best cares for it. Now, as I stay here, again, I've done this for a while now, I tend to get achy in my low back. I'm very familiar with how my low back kind of gets rigid in relation to my pelvis. We've got lots of different ways, lots of different myofascial self-treatment practices to help ease that. This is simply one of them. I'm going to start to slow my own breathing here. Quiet in my mind. I gently feel through the length of my spine, looking to encourage a rotation. Now, as I do, I am using the back of this chair to give me a good bit of support. The aim is not to rotate and look all the way around me, but that is kind of an indication of how fluid the myofascial tissues are and how much rotation they allow. I can eventually, I'm getting close to being able to grab on there. And again, that just allows, I'm going to call it gravity doing the work, which isn't quite accurate, but I can let go of all the muscular tension in this right shoulder as I just kind of hook on there in a way that allows some of the tension in my upper body to ease. As you're here in this rotation of your own, and I apologize, I'm not going to look at the camera today because I do want to just follow my spine. I don't want to twist this way and then in my neck twist this way. That's not going to help me. As you stay in this release, see if you can bring your awareness to the spine, almost like you're wringing it out like a washcloth. You'll be able to feel and notice where areas of those vertebrae kind of don't rotate in relation to each other. That's the thing we're working with here. Let this be easy. Now, I know I've got a good hold here with my fingers, but everything else in my body is fairly relaxed in this rotation. Imagining I can breathe all along the length of my spine. I can feel where tension tends to accumulate in my left hip. Again, I have to focus to keep that soft and allow it to drop. If you don't have a good chair or you're doing this on the floor, be mindful that rotational releases, because they have an active component to them, can be a little bit difficult. My spine's starting to open and start to adjust, which feels really good actually. It can be difficult to maintain these rotational releases if you don't have a good base of support or something to kind of help with that rotation. It can use a lot of muscular effort if you don't have something like a chair back or a wall, something to rotate and twist into. Because of the active nature of this, I do tend to stay with this not much longer than 5 or 6 minutes, but with this one, like I said, I can feel my spine starting to kind of adjust, which feels good, but that feels like that's kind of done what it needs to today. So when I come out of this, I want to slowly derotate. Don't want to just snap right out of it. Oh my goodness. And I do want to test movement just a little bit. I've had a rotation, so I tend to bend and shift, and it feels really good and open there on my right ribs. So with this release, with rotational releases, I very much want to do both directions. I don't want to open one side of my body and then kind of leave the other side kind of not having some space. And so when I'm ready, I will again get my spine nice and tall. I have my pelvis supported on this chair, my feet flat on the floor. This is important for me. You do want to find a place that's comfortable for you. Let this be your own practice. When I'm ready, I will start to rotate. Now, most of us have an instinctive, intuitive knowing. I didn't consciously do this, but I went the direction of ease first. I went the direction my body tends to rotate most easily first. Didn't know I was doing that, but I did. You might notice in your own body, if you're doing this from an instinctive, intuitive self-treatment place, you might have also chosen the direction that was easiest first. So I can tell with this, it's going to take me a while just to settle in here. Now, consciously, I do have to make sure my right shoulder drops. I tend to want to push into this. That's not going to help me. This arm behind me is all I need to hold my spine into this rotation. If you can imagine, when I drive, I have trouble looking over this shoulder sometimes, depending on how little or how much rotational ability I have in my spine and my ribs and my shoulders relative to my pelvis. Now, you may have heard me say, or you may remember, the area that hurts in a body, the place that is painful, is very, very rarely the place that is troubled. Now, I'm aware of some tension and tightness and some achiness I get in my right ribs. I very rarely notice my left ribs at all. But as I work with this rotational release, I can feel that the trouble is actually very much over here on the left, far more than I felt on the right. Achy on the right, stuck on the left. We want to actually find the places that are stuck in the body and work with those. That will actually do far more to ease the tension and achiness in my right ribs than always working directly with my right ribs, although I do need that rotational release also. Now, as I work into this direction that is a bit less easy, there is a tendency for me to kind of just collapse forward. I'm doing my best not to do that. I do have a hand on the outside of my leg to kind of support this rotation. And again, my elbow on the back of this chair, encouraging my body to not collapse. Ribs can tend to cramp. Again, you don't need to push into that. You want to be able to soften in your body. If it does cramp, soften and breathe into that area as much as you can. Remember, the quality of your self-treatment is vastly important to the type of results, the type of sensations, the type of space you're going to start to create in your body. Quality of self-treatment matters. Quieting your mind, feeling the support of the chair under your butt, under your feet, the floor under your feet, the support under your arm, letting the rest of your body get soft, letting go of as much muscular tension as you can, breathing into areas that are tight, feel like they maybe don't move. I want to deliberately here bring my breath into those tight areas of the ribs that I'm becoming aware of. Slow your breathing, quiet your mind, and gently feel what's happening in your body. Depending on your particular patterns of myofascial restrictions, you might feel this down into the hips, into the pelvic floor. It might become an achiness in the low back, the mid back, the shoulders. You might feel this in your neck, even into your jaw or your eyes. Your patterns of restrictions are uniquely yours. Engaging with them in an instinctive, intuitive, internal sense that is also uniquely yours is what will make this most beneficial. You don't have to do anything I say. Again, just giving some pointers, some ideas, giving you a sense of how this might go for you. My left ribs are getting achier and achier as I stay here. But I do want to stay with this a good 5 or 6 minutes. I notice for myself, if I push a bit too far into this rotation, I start to get sharp stabby pains up in the right side of my neck. I want to avoid that. Again, we're not looking to push into pain. I know I'm not anywhere close to being able to get this right hand there to support this rotation, but that's okay. We'll come back to this again and again over the next few days, over the next couple weeks, and see this improve. This is getting easier. I can feel it's a whole lot less effort to stay upright rather than collapse. My right arm is gaining some ease and space as this rotational ability increases. Another moment here, and I think my body on this side will be done. There's some other things I can do to open through these ribs more directly, which again I will get to later this week probably. When I am ready, I am going to come out of that rotation slowly because it does tend to be achy for myself. I like to round and kind of arch my back and twist and bend just a little bit. These ribs right here are quite restricted. And again, there are other things I can do more directly there later, maybe later tonight after work, tomorrow, in some of our myofascial moments. For now, be curious about what this does, what this can help with in your body. The most common one I see is when we're driving, we want to look over our shoulder. We might tend to move just our neck. We get a crick in our neck. We get a strain in our neck because we can't actually twist all of our upper body. We try and move just this section of our spine. It doesn't work too well. So test this out for yourself. Be curious. Thank you for joining us. We'll see you next time.